Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Lee Frame, Chief Wellness Officer for GW Medicine, Executive Director of the GW Office of Integrative Medicine and Health, and an Associate Professor in the Departments of Clinical Research and Leadership and Physician Assistant Studies here at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today, we're talking about fitness psychology with leading experts in the field, Katy Bowman and Diana Hill, PhD, authors of I Know I Should Exercise, but ... 44 Reasons We Don't Move and How to Get Over Them. I love that title, y'all.
It is a great title. Katy is a biomechanist, best-selling author, founder of the movement education company Nutritious Movement, and host of the Move Your DNA podcast. Diana is a clinical psychologist, international trainer, author, sought-out speaker on acceptance and commitment therapy, ACT, and compassion, and host of the Wise Effort podcast.
Katy and Diana wrote the book specifically to provide health professionals with the tools to better connect with and support their patients.
Welcome to GW Integrative Medicine, Katy and Diana.
Thank you for hosting this.
Thanks for having me.
We're glad you're here because this is an exciting topic. But before we get to the new book, could you explain what fitness psychology is to our listeners?
Well, I think of fitness psychology, also sometimes called exercise psychology, as a field that's exploring the psychological factors that influence our physical activity levels, our physical activity choices, and our exercise habits.
There's so much about the biomechanics and physiology of exercise, but oftentimes we neglect and don't think about what's happening in the inner world and how we relate to our thoughts, our feelings, our motivation around moving our bodies. And that plays a big role in terms of whether or not we move and how we move in our lives.
Well, that is a great starter. I think that something I also want to just touch on quickly is the various different definitions of physical activity, movement, exercise, and how all of those things fit in. I think maybe we should start there too as a kind of a basis for our audience so we are all understanding the terminology appropriately.
Well, I do think a lot of these terms are used interchangeably, and that might be part of what creates sometimes our inner barriers to movement. So physical activity is often used in clinical research about general activity levels. It doesn't necessarily mean that you're getting your movement through exercise, which tends to be more rigid in its definitions. You know, there's a predetermined mode of activity that you're doing. You're choosing to ride your bike or take an exercise class or lift weights or take a walk. You are picking the intensity level and the duration you're going to do it. And a big hallmark of what exercise is, it's about a physical activity that you're doing specifically to make yourself better, where physical activity is a much broader category that exercise fits into. But you could also have, doing yard work on the weekends. That's part of your home chores that you need to be able to do, but you would still be physically active in the sense that you are changing your body's geometry, you are loading your skeleton and muscular frames, you're expending caloric energy while you do it. So it's just to make sure that in our minds we have a broader definition of movement that can pick up both physical activity as well as that subcategory of exercise. And that's why I wanted to clarify with fitness psychology, we could probably even talk about it as more broadly than just are people exercising or not. It's how do we make those choices to take the stairs at work? How do we make those choices to walk to run an errand as opposed to drive? And a lot of that would be more movement psychology, but there is no field of movement psychology. It's really in that it's either in sports psychology, real specialized athletic movement, or it's in exercise or fitness psychology right now. So we're trying to push on those boundaries a little bit.
And it's also how we think about for our clients and patients, how they're relating to their exercise or what they perceive as lack of exercise. One of the reasons that we had show up in the book was a hairdresser who said, I'm on my feet all day, and the last thing I want to do at the end of my day is go be on my feet and, go run on a treadmill or something, right? That maybe that experience of that person, the best thing wouldn't be for them to go run on a treadmill when they've been on their feet all day. But there's other ways in which their body hasn't been moved, which is what Katy talks a lot about in terms of nutritious movement. And then my angle is, okay, and how is our psychology getting so rigid about exercise that we're neglecting this whole arena of moving our bodies, that our clients could be moving bodies or already moving their bodies, but they're beating themselves up for not moving them. And that plays a role in our relationship with movement and physical activity in general.
Yeah, absolutely. And I think that's what's kind of exciting about this book is it's really a fresh take on how do you reach fitness and what's the psychology behind that. A lot of our audience is healthcare practitioners. What are some of the big elements in the book that you think would really speak to that audience?
Well, the way that we structured it was looking at this combination. So Katie's a biomechanist, I'm a psychologist. And so we looked at this combination of the psychology, all the factors that contribute to reasons why we don't move, or maybe we're moving in one way but need to be moving in lots of other ways that we're not. And we use ACT, this evidence based approach, in terms of our psychological flexibility. So, looking at how are people's thinking patterns and their relationship with their thoughts. Do they believe their mind when it says something in the morning like, I don't want to get out of bed, or I'm too lazy to, get myself to the gym, or everyone else is going to be more in shape than I am? Or are they able to be more flexible with them? We look at motivation. Are they motivated by extrinsic rewards, or do they have more inner motivation like values? And we also look at things like their acceptance of discomfort that comes with things like if you have chronic pain, or if you are embarrassed, how do we work with those uncomfortable thoughts, feelings, sensations that show up? So I address that mainly through an approach called acceptance and commitment therapy, or ACT, and it's about developing psychological flexibility skills. And we set up these psychological flexibility skills, and in addition to self-compassion practices that are all evidence-based, but applied in a real world way to the reasons that people wrote in about why they don't move. And then Katy brings in this nutritious movement component, which is such a new way of looking at movement.
The thing that we wanted health practitioners particularly to be able to get from this book in the most simple statement is, it is not the person who's not uptaking movement or the movement prescription or movement recommendation is usually not being lazy. Like that I, even just through writing this book with Diana, I began to understand the concept of motivation so much better, where I think we would say that people before, I would say, and in this field of movement, it would be like, people aren't being motivated. They're not being motivated. They're not motivated perhaps by the idea that exercise is good for them. And that's, to me, the biggest takeaway for health practitioners is, if someone is not picking up movement because it is good for them, then that is not the path to continue. Like, that's not the drum to continue to beat, to try to keep motivating them. Like, maybe they don't have enough scientific research behind why they should move more, that the internal barrier is much more complex set of barriers. It's not even one, right? There's a lot of factors going on. Some are extrinsic, some are intrinsic. And that if practitioners could have a better understanding of the complexity of motivation, a big aha moment for me in reading some of Diana's contribution to this work as we were writing together, was that you could be motivated to not move, that you could actually be fully motivated to not move, because the payoff of not moving is setting you up in some way that's helping you. And I thought that was, as someone who comes from more that allopathic side of just, we all would make choices that are really good and healthy for us, that was a real eye-opener for me, being myself a practitioner trying to help people move more, of like, this is much more complex than I think that there is any writing for out there for practitioners. There's no one really breaking down. We all know that physical activity is just this it's such an important medicine that we would love people to be able to pick up and utilize. But I had no idea of the complexity behind the very good reasons why people wouldn't take it.
Yeah. It's sort of like knowing that fruits and vegetables are good for us. We all know that,
Mhm.
but we're still not getting our fruits and vegetables.
Right.
We
That
know
doesn't
that
seem to make a
exercise is good for us.
difference.
So beating that drum is not always the most effective. And we have more sophisticated tools in the field of psychology to address motivational barriers, thought barriers, all sorts of things that now we can apply to movement and exercise as well.
So, one of the major tenets of integrative medicine is motivational interviewing. What role might that play in this process?
Well, motivational interviewing is an evidence-based approach, and certainly part of and included in acceptance and commitment therapy. It's included in, acceptance and commitment therapy is looking at these 6 processes of how we are related to our inner experience. And what motivational interviewing really targets is helping the client come up with their own personal reasons for change, rather than imposing your reasons for change on them, and then you get this resistance back. And the way that motivational interviewing does that is through these very open-ended, client-centered questions where they get to, kind of talk about the ambivalence around, like, a part of me really, really wants to move and another part of me really, really wants to stay in bed, or a part of me is really excited and a part of me is really scared. And so giving that space, we bring in motivational interviewing strategies into the some of the practices that we teach, and we actually are specific and say that in the book that we're using motivational interviewing here. But that's only one element. We actually address other elements, other approaches as well, above and beyond motivational interviewing techniques.
Yeah, I think that's very helpful for our audience because I think you were sort of hitting on it from the other direction. Like, here's what you shouldn't do. Don't just keep throwing the science at them and
Mm-hmm.
thinking it's going to affect them, but then flipping that and be like, okay, well, how do you figure out what is going to affect them? And obviously, that's going to be very different for every person.
Yeah, well, motivational interviewing doesn't address things like how to be with a difficult sensation. Motivational interviewing doesn't have that strategy.
Right.
Motivational interviewing doesn't talk about things like how to work with a difficult thought, how to get some distance from that thought, and doing something called cognitive diffusion and ACT, where there's a good amount of research behind that practice. So I see it as like one part
Hmm.
of a bigger um, set of tools that we're working with.
Right. It's like the first step.
Hmm.
Very helpful. Excellent. So, I mean, I followed Katie for a really long time, and she's always talking about all the different types of movement that we need to get, and how it's like, have to move our bodies in all the different ways, just like we need to get all the different nutrients in our diet. But I wonder, like, it sounds like one of the major limitations is that we just don't get this sense of joy from moving our bodies. And how can we help people realize that, one, there is a way to do that, and figuring out what that is for them so they can have more of a joyful experience. I'm going to give you an example of something that's working for me really well right now. So I was at the International Congress on Integrative Medicine and Health, and one of our big events was dance therapy, and I was all into it. And she kept saying, "Why don't we do this every day?" And I was like, "Why don't I do this every day?" And so my goal has been, if I have a stressful day, that's what I do now at the end of the day. I just put on 2 or 3 songs and I dance like, I'm a 4-year-old, right? I just really enjoy myself and I move my whole body, and that for me is very joyful, and I look forward to it, as opposed to, if I felt like I had to go on a run, right? It's going to be really hard to get you out there. So, how can we promote more of that sense of joy?
Well, I think first is developing that flexibility around what counts as
Mm,
exercise. So if I interviewed a bunch of people and asked them to list 3 types of exercise, I bet that many of them would list very similar things to each other. And it's all that sort of those fitnessy examples, taking a run, using some piece of a gym equipment, where it looks like what belongs to the so-called house of exercise, where for many, I mean, seen people argue that taking a walk isn't exercise. Like, we're at the
what?
point now where, there's even health practitioners who will say, well, walking doesn't really count towards this to getting your fitness goals developed, because it should be at this type of heart rate and this intensity. And so we're sort of bogged down now by we're using the same words to talk about different elements to movement. And so to recognize, well, it's part interviewing, like, what are you hoping to get out of your movement? I hear, Lee, that you're saying, I need joy out of my movement. And
Mm-hmm.
for me, I get this sense of joy when I'm dancing. So therefore, dancing is a really good, effective type of exercise because you find it joyful. So loosening up around what counts. I mean, a big part of what I like to do in the world is saying movement is such a broad category. Once you stop thinking about it as needing to be exercised to meet your needs for physical activity, it opens up things like, I want to spend all day in the garden,
Mm-hmm.
or I just want to roll around on the ground with my grandchildren. To really be able to frame that as these essential physical moves we need to be able to do. For me, that's the first start of being able to connect with the thing that brings us joy, is by giving us permission to say all movement counts. It does not have to be what fits into the very small exercise box.
There's sort of three things that I would do with clients to explore this. The first is listen to my clients and notice when they have a sense of vitality when they're talking about something. And it may be that they're talking about their friends. And anytime they talk about this group of friends, they get excited. Or maybe they're talking about their music, or maybe they're talking about the dog, right? So it doesn't matter whatever floats anyone's boat. What brings you joy is unique to you. Maybe they're talking about the garden. And then how could we pair that and combine that with movement? So that activity is part of your move. You're walking with your friends. You're playing with your dog. I love to sprint with my dog. And then, if you want to build in your quote hit training, guess what? Dogs are the best hit trainers. They sprint and then they lie down in the shade. So they already know the drill. And listening to your clients rather than imposing our values on our clients, but really listening to your patient. They already know. The second thing that I would do with a client or a patient would be ask them about how did they like to move when they were kids?
Mm-hmm.
What was play for them? And if we can bring play in, play is a natural reinforcer, and the nature of play is that it is sort of separated from all those rules that Katy was talking about. It's like so bringing more play into life through movement. And then the third one is with our movement, how we could make the movements that we're doing more enjoyable.
Mm-hmm.
That may be things like this temptation bundling that we talk about in the book, where you pair things that you don't really love, because we're all going to have to do some kind of movement. Sometimes it's not enjoyable. Like not every movement is frolicking and like sometimes you got to do the PT exercise to support the knee.
Right.
Right? It's not fun. But how could you pair something with that PT exercise to support your knee that makes that PT, maybe it's your favorite show, or maybe it's doing it in your favorite place in your house. And that temptation bundling, which comes from some of the research by Katie Milkman, has been shown to increase people's frequency of movement and consistency within the long term. So using temptation bundling as a technique to bring more joy to the kind of some of the moves that we don't always want to do, but are good for our body to do.
And then also, just to piggyback on that, is to do it in the other direction, where there are some things that I would not count as physical activities I need to do, but just things I need to do, like clean my house. And I would pair that with something that I find joyful, like blasting music. And now I'm finding that there's a lot more physicality. It's not just this chore that I have to do. It was an opportunity to, get down on my hands and knees and really do some cleaning, doing high reaches, and I can feel my heart rate coming up. And, if you're giving recommendations for movement on those sheets, there's always talking about vigorous cleaning, chores as a way to get the physical activity we need, but it doesn't have to be so boring. We can make it joyful by, listening to a podcast that we like, or just trying to make a party out of it in some way, or whatever infuses a little bit of joy is another way to just make over, your life for more movement.
One of the strategies that Katie and I talk about is the both and strategy in the book instead of either or.
I
And
like that.
I'm moving this week, moving to a new house, but the new house is like 4 doors down. I was thinking about, well, gosh, I could either go to my exercise class or, I can fit my moving in. And what we ended up deciding to do is I'm inviting friends over for HIIT training. And it's called pick up a box and walk it down the road and put it down. It's basically the same thing that we do in the gym. You pick up a
Yeah,
weight.
you're right. I mean, if you're
And
going to a
and
CrossFit
actually,
class,
yeah.
that's
And if
going to
I
be in
frame
there.
it that way, it's like I don't feel. I'm like it's like you could pay me actually $25 to come HIIT train at my house. But this is what I've learned from Katie is it doesn't have to be so either or. We've gotten so rigid in our ideas around movement that we compartmentalize it to some separate thing we do separately without people, or that we can if we bring it back into our life, then it's a both and I'll have more fun moving, and so will my friends will get their exercise, and all it's all good. So
That's wonderful. That's really helpful. One of the groups I work with a lot I work with busy people a lot, period. But I'm thinking about our residents. They're really time constricted and often financially they have all the constrictions that you could place on someone. And they really struggle. And I try to give them examples of how to incorporate it in their day, but I think it's a group that really struggles. So I wonder if you might have some advice for that group.
Well, I'm thinking about walking, studying groups, or reviewing your notes in an audio format while you're outside moving around. I would probably, not knowing exactly what everyone's doing, categorize like, how do you feel like you need to spend a lot of time right now studying, other household or personal chores, and then try to look to ways to infuse those with movement. And then also, what are ways that you could change the culture of maybe these less flexible parts of their day-to-day containers? Like, is there, when they're doing work or other schoolwork, is there an opportunity to get up and out of a chair? Is that acceptable, or is it a
Right.
requirement that when you're studying, everyone, or when you're in a learning situation, everyone is like sitting at their desk? Or is it, everyone stand up and let's do some stretches while I go over this slide with you? You really giving permission to do something else with the body, because we are very much sort of culturally bound to being still, and the institutions are sort of keeping that legacy going. So it does take signage, verbal permissions, and then people being willing to be the person up out of the chair in order to make it more of a comfortable thing. But if you do it enough, then people just recognize that that's an option, and then they're able to follow their own maybe inclination to move more instead of having to stifle it to be successful.
I train therapists quite a bit, and what I started doing in my trainings was incorporating movement as part of it's part of my workshop. So when we're circling up to talk about, discussion topics, I'm having everyone stand up, go around the room, mingle, find your group, and have a conversation. Now we're standing and having a conversation. So we've moved from sitting to standing, right? Just that we know the benefits of just standing up every hour is great for our body. And I would say at the level of like the higher level of education, like the professors and the instructors, start to do it, start to model it, so that we're giving permission. And part of that requires psychological flexibility, because you will be doing something that's it's uncomfortable for me to step outside of my comfort zone and say, okay, everybody stand. I feel a little bit of this. I'm kind of doing it differently than how it was taught to me.
Right.
But if we want to change the paradigm around a whole unhealthy situation around movement, then we have to be uncomfortable. And then we're modeling that to the practitioners that then are going to do the same thing with their clients. Because one of the things that Katie said to me a number of years ago, I was talking about doing walking meetings as a therapist, and some of my best sessions are walking with my clients. And she said, well, do you have that advertised on your website?
Oh.
And I was like, oh, yeah, that would be a good thing to write. Like, I offer walking sessions and I offer walking meetings. And if you want to do this walking with me, then we both benefit. And when I'm walking with a client, at the end of that session, I feel dramatically different for my next client, right? So we have to also be psychologically flexible as practitioners as we're working with our clients and patients to become more psychologically flexible as well.
And I just have one more thing to add to that, where when you get to the point where you're prescribing, when you're at the point where you're prescribing movement to someone else, and you yourself haven't really figured out where it can fit inside your life, except for the exercise box, you're not maybe fluent in listening to someone's movement needs and responding in a flexible way. And so I would be curious to know what is the coursework around physical activity at the level of this schooling, and is part of the coursework. I mean, there's always studying the physiology and the anatomy and those responses, but equally important, especially when you are now a coach and a counselor, like that's ultimately what a prescriber is. It's like, it's not just giving it, it's helping with the uptake a little bit, is to have practice in fitting it into this very stressful time, because I don't think the stressful time decreases after you graduate. I think it is the beginning of the staircase of it becoming more and more stressful. And we see a tremendous drop off of physical activity after school age. And I think that this is the part that's missing, is we do not have any education for how to integrate movement into life. It's very easy to say to do it, but when you have a bunch of people who themselves don't do it and kind of get the theory of it, but they're not as diverse in all of the different ways the barriers to movement can show up, not only internally, but externally too. There's a lot of just hurdles and boundaries to movement for a lot of different systemic as well as just individual reasons. I think that's the education we're trying to provide, because it doesn't really exist. I haven't seen in a real, in coursework for the people ultimately doing the prescription. So that is our hope, as well as the individual is able to make some corrections, but that the people prescribing and assisting, the masses will have some understanding of it too.
Absolutely. So we are starting to run a little bit low on time. Is there anything that we should talk about that we haven't covered yet?
I guess I want to say that the book was designed as 44 reasons why people don't move. And the way we came about that was we actually asked people, why don't you move? And they wrote in their very specific, this would be like you're sitting in your office and you're like, okay, so let's get walking this week. And they start listing all the reasons why they can't. I don't have enough time, and my husband's on the couch, and I have chronic pain, and all the things. All the things. And the air quality is poor. And let me tell you, my neighborhood is not a fun place to walk in. There's no sidewalks. And so all of that. And so you'll hear in these questions really real human answers that are complex, like the real humans that come into our office. They aren't the textbook answers. They're the complex ones. And then we took those answers and we organized them into these themes. But what we did is we applied what we know about psychology and about biomechanics from Katy's perspective to address these real human answers in a way that could apply to many different humans, because we're all very diverse, and then we also all have human brains and and human bodies and things that we avoid and don't like. And so that's what's really fun about it, is that if you're reading this as a clinician, as a practitioner, as a coach, you're going to get some nuggets of tools of how you can respond to anybody that walks in your door with any of their complex answers. And you'll have now you'll have the flexibility of responses to get people actually moving, instead of just saying you should move more. And then they come back in 3 months and you're saying again, you should move more. And then you say, I know I should exercise, but, and there we go again.
Okay, so where can our listeners buy the book, find your podcasts, and you on social media?
You should be able to find the book anywhere you get books, your local bookstore, or if you order online. And you can find me, Katy, at Nutritious Movement, everything, website, socials.
And you can find me at Dr. Diana Hill, everything, website and socials as well.
Brilliant. All right. This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Lee Frame.
And I'm Janet Rodriguez. Thanks for listening.